Welcome to NP's Changing Practice, and I am Dr. Carol Berger.
Hi, I'm Dr. Nina Zimmerman.
So today we're going to talk a little bit, to just the two of us, about being educators. I've known Dr. Zimmerman now for 7 or 8 years.
Yeah.
And you were the lead teacher of the Advanced Health Assessment, which was the first class that I started teaching way back when. And it's changed over the years. And one of the things that you introduced, or you did, was introduce this tool that you developed to help students know how to document. So tell us a little bit about how as you were designing this course, what problems students had with advanced health assessment and made you decide to create this.
Sure, Carol. Well, first of all, I know some of you have been listening to our podcast for a while, but Carol and I have known each other for 8 years, and we not only work together, but we are colleagues and friends. So we've never said that on the podcast.
Yeah, I don't think we have.
But, let's just, disclose that to our listeners. But it makes this so much more fun. Yeah. So the SOAP note stands for Subjective, Objective, Assessment, and Plan. And so a lot of nurses have heard that term before, but we do use it a lot in education when we're teaching nurses to become nurse practitioners, changing in that role as a provider, because it is basically your documentation template when you care for patients.
Mm-hmm.
So in advanced health assessment, you not only learn your advanced assessment skills, but you learn how to do a history, and you learn how to collect the subjective information, which is what the patient tells you, but also gather objective information, which is, any kind of data like vital signs or lab information. And when you put your hands on the patient, that's your objective physical exam.
Right.
So, yeah. So when we've taught health assessment, advanced health assessment in the past, what I found was, after teaching it for several years, or for a couple of years, is that students had a difficult time with learning how to document. So they were doing pretty well learning how to do a history because they're nurses, and they started putting together advanced skills. But then when they had to put it all together and document, totally different than a nurse.
Yeah, because it's a totally new way of thinking. Like you said, nurses know about SOAP notes, they hear about it, but we've never documented as a nurse in that format, and it's just completely different. And they had a lot of times in my classes a hard time distinguishing what was subjective and what was objective. That was really hard.
Yes, that's what we found, and we even talked about this, Carol, early on. So I had the opportunity to really think this through when I was pursuing my doctorate in higher education. And so for my dissertation, I actually thought about and researched this problem, because I was very passionate about it, because advanced physical assessment was my course that I was teaching, and course developed for many years. And so I came up with this template that we'll show in just, if you're...
Yeah, we'll share it. We'll let you see, and we'll walk you through it.
Yeah, and we'll put it on our website. And I developed this tool, not only just the tool, but videos for our online students to understand how to use it and what it's about. So it was important. We understood as educators that students were having a problem documenting these SOAP notes. So we actually guided them in this documentation template of what each piece requires, right? So your history of present illness, if you follow the mnemonic, like old carts, where it's onset, location,
right,
duration, et cetera, all of that information from that mnemonic is on there to remind you what needs to be listed. And when you do that several times,
you'll get it.
Yeah, you'll get it.
I will honestly say I was there when from before that documentation came in, and I would say students' scores on, because part of a health assessment is that they have to do so many clinical hours. and they have to turn in, I think back in the day it was 10 notes.
Yes.
And
yes.
they didn't have a template, and they would lose points a lot in the beginning because everything was mixed up and they didn't have things in the right order.
Right.
And they wouldn't understand how to fix it as well. And you try to explain it, but when you introduce that tool, it made a tremendous difference in helping them understand what parts went where. And it's a great tool to assess them. Like Dr. Zimmermann said, Nina, we will have this tool available on our website where you can download it at some point. I don't know exactly where we're at with that, but we'll
right.
get that.
Right, we will. And it's I think it's helped. I also measured having that not having that tool, and then using that tool with guidance with videos and other instructions. And when I measured their self-confidence went up and their anxiety actually went down statistically significantly before compared to the before students who didn't have that.
Yeah, because I think they feel like they're like a fish out of water.
Right.
And, that is the thing. When you're going from an RN to an advanced practice nurse, you are learning a whole new set of skills. It's not like you are adding skills onto what you already know. You're being taught a different way to think and document. And what I would say is the way you've got your tool set up, and if they follow it correctly, follows the guidance for billing. And
yes.
that's what students don't understand is what's so essential in that SOAP note. And that's a discussion another day.
Oh,
but
right.
yeah, but it's tied to billing. So how many things that you talk about in each things determines how you bill. And if you don't do it right, you lose all kinds of money for the practice. Right. So this is we're going to show that whenever you're ready. Why don't you share your screen?
Yeah, I will share my screen now. If you're listening, no worries, because we're going to post it for you to either download. You may have to spend a small fee. We haven't done it yet, but we're hoping this will help nurses who are becoming nurse practitioners. You could possibly use this in your clinical courses to help you learn how to document better. Bring it, I encourage you to bring it to your clinical if it would help you document.
Well, yeah, you could make a bunch of copies and just have them in a notebook.
Use it,
and that way, when you got home to write your SOAP note, you have all the information you need gathered in a nice brief.
Exactly.
Okay, Nina, we got your document up. So tell us about your document.
Yeah. So this is something I created that we use in our courses, and that when we post this to our website, you are welcome to use. So for those of you who are listening, if you're interested in this, go to www.mpschangingpractice.com and you will be able to see it probably in the next, I don't know, month or so. It won't happen.
We're working on the ability to put things on there that are downloadable. Right now, you do have educational games that you can play.
Yes.
You do have case studies you can go through and see what to do with those.
Yes.
So you do have all of our podcasts in one area. So,
yes.
You could definitely listen to any podcast. So, and we're going to be putting educational material up in our store, and cute cups and things like that might help you remember some concepts. So definitely check it out. It's going to be at the end of our YouTube video, but if you're listening, it is NPS Changing Practice. So it's NPs with an S, changingpractice.com. And you'll see me and Nina and all that we have to offer. But tell us about this SOAP note.
Right, Carol. So this is the SOAP note. S for subjective, O for objective, A for assessment, which includes your diagnosis, primary and differential, and then your plan, which is treatment and education involved. So on this form, it first starts with your chief complaint, which is what your patient basically schedules the appointment for, and it's in their words. So it might be
right. That's important. If that little tiny thing is out, it goes to the lowest bill that there is. So you have to have that chief complaint in the patient board. And it's not a paragraph.
Nope.
I have a sore throat. I'm here for my sore throat. I want to lose weight, whatever it is.
I have a headache. I'm here
Right.
for a follow-up, physical exam, whatever. So that's very important in your note, if you can believe that. And your history of present illness is where you're taking your history and you're recording your history. And this is a chronological order of events. It's your state of health before your onset of your chief complaint. And it includes old CARTS. That's a
That's
mnemonic
an
for,
acronym. Yeah.
yeah, I'm sorry, it's an acronym. Thank you, Carol. It's O is for onset, L is for location, C is for character, A is for aggregating or associated factors, R is for relieving factors, and then T is for temporal factors, like other things that are going on, and then S is for severity.
So if
This
I came to
basically,
you and I had a chief
yeah,
complaint of sore throat, you would
yes,
say, Carol, how long has it been going? Did it come on all of a sudden? Or
yes,
did it come on over a period of days? So, it might be sudden onset, right? Where is it
yes,
hurting? It hurts in my throat. What's the character? It feels like I'm swallowing ice picks. Every time I swallow, it hurts, right? And what makes it better? What makes it worse? Well, cold water and ice chips seem to make it better. And I've been spraying some of that chloroseptic spray, and that makes it better. Sometimes I take a Tylenol or an ibuprofen, and that seems to help some, but it wears off. Those are all of my associated factors. And within that, I've also said my relieving factors, right? That's ice
yes.
chips, and that's, so you kind of listen, and then nothing really, there's nothing else real. Well, you could say I have body aches and fever. I've been noticing body aches and fever. Those could be other things going on. And how bad would you rate your pain? Well, yeah, I'd say it's a 7 out of 10.
Yes,
Now that's everything you need in that
everything.
history.
And
Right,
you write that in a narrative form. So
right.
you get really good at listening to your patient, asking these questions, and at the same time, you're
Kind of.
typing in a narrative form what
Mhm.
was transpired in a very short and concise way. And then your history, so that might already be in your electronic medical record
That sometimes will
already.
pull it in. Yeah.
So it'll pull it in your note, but it's also on here that it's important. So your past medical
But it's
history.
perfect if they're in clinic. They're
Yeah.
not going to be able to have the health. They don't have access to health record outside of the clinic, so they can jot a few things down. And you don't
Exactly.
have to get every single solitary thing down.
Nope.
Just a
Nope.
few things. Have you had any surgeries? Are you up to
Nope.
date on all your immunizations? Do you have any
Yeah.
allergies? What medications are you taking? All real
Right.
easy.
And then family history, what's, if the patient knows anything about their parents or grandparents, in
Brothers,
particular,
sisters.
yeah, brothers, sisters. So high blood pressure, diabetes, heart disease, previous heart attacks, cancers. Those are things you want to record because it may be applicable or helpful for you when you're trying to figure out your differential and primary diagnosis.
And I love
First,
how you did personal social history, because those are the main things that we're really focused on. Now, education, marital status are okay, and occupation is fine. But what we have to have for billing purposes and to really look at that patient is alcohol use, tobacco use, recreational drugs.
yep, very, very important
Anything
because,
else there is great to know, but it's not going
right.
to apply to billing. But the other things apply to billing. So you have to have some of those in there.
Right, right. So that's really important. And a good EMR, a good electronic medical record is
We'll
going
pull it
to
for
have
you.
those, pull that up, and possibly the medical assistant will be doing that. But you need to know how to do it as a nurse practitioner, because I don't know about you, Carol, but I used to do all of it when I had a patient in my rural clinics or a clinic that we didn't have a lot of money to have a lot of medical assistants. I would end up doing everything down to doing the history and the vital
We
signs and
didn't have it. We
everything.
had that. This would have been so
Right.
good to have. Now, this is the two parts that are the most confusing for students, and
Yes.
where they lose the most points in those early SOAP notes before they begin to, get used to it. They'll mix up review of systems with physical exam. So
Right.
explain the difference between
Right.
review of systems and physical exam.
Right. So review of systems is per the patient's information. So it's subjective information, the information that your patient tells you when you review their systems, their health,
Right.
their
So if I
the
had a
systems
sore
of life.
throat, what are some things you would ask me?
Right. So for sore throat, you could say, well, you're telling me you have a sore throat. So you could say under mouth and throat, positive for a sore throat. denies difficulty swallowing,
Right.
denies, whatever,
You could
denies,
say runny nose presence. You could
yeah,
say,
yeah,
I'm running a fever. You could say, I
yes,
feel a little tightness in my chest. I'm feeling a little wheezy. What you're doing in review systems is triggering the patient's memory because they don't
right,
remember everything. So you're the one asking questions saying, tell me, have you lost weight? Have you gained weight? Are you having a fever? Do you have any changes in your hair, you notice a rash? Are you having, and you're trying to, and you just keep going down the line, any vision changes, any hearing, any problems with your mouth, any problems,
right,
with shortness of breath or chest pain,
right,
your heart racing, and you have to use those kind of words. Now, some systems require you to say patient complains of, patient denies. Other systems say +4, -4.
right.
Be careful there though, because when you say just
Mhm.
positive and negative, sometimes if you say positive for a red, irritated throat, is that subjective or is that objective?
True. Good
And
point.
how does the patient know if it's red?
Right.
Right. So
Right.
you have to be careful. So, it's to be on the safe side, always saying patient complains of or patient denies makes
Patient
it.
complains of and patient denies, you're right, is probably the best.
Yeah, I
And
mean, there's no doubt there. It's in the
there's no
patient's word
doubt. And you may be given direction from your faculty which
to
way
do
they
it
want it.
different. Yeah.
But basically, if you're doing a full physical exam and a full follow-up, you might do all the review of systems, right? But if you're doing a focused exam, this person's coming in for a sore throat, really you only need to do like at least three
Yeah.
systems, right?
Yeah, you don't
So,
have to go all the way down. You're not going to need to do the breasts and the,
right,
neurological and psychiatric. You're going to do more. Yeah, I always say, always do cardiac, always do
always.
pulmonary.
I say the
Always,
same thing.
that those are just two you really should always do. And then focus on 2 or 3 other things that pertain to the problem.
Right. So for me, I would probably say general. So that
Mhm.
includes fatigue, fever,
I'm complaining of
complaints,
achiness, fatigue,
complaints of
fever.
body aches, complaints of complaints of fever. Then I would probably say mouth
Something
and
about the
throat.
ears because that's connected to
Yeah,
the
you could
throat.
say true,
Denies
true.
ear pain, has a runny nose, a positive
Yep,
for runny nose, positive for sore throat. I might have ulcers in my mouth
yep,
or lesions. That would be
yep,
possible, and then you just go to cardiac and respiratory and you've got it made.
yep. And again, it's complains of or denies per the patient, per your interview, the patient, per what the patient is telling you, right?
Right.
So
Now
then
we're in a different, now we're in a
now
different
you're getting
world.
into physical exam. Now this is when you put your hands on the patient and it starts with vital signs, maybe, pulse oximetry, maybe your pain score, if you're doing a peak flow with a patient with asthma, those are all objective
Or
data
if
that
you do a
you
strep test,
just strep test, fluorescein,
UA,
stain. Yeah.
look
All
at
of that would
labs, look
go
at
in.
radiology is all
Right.
under this
It's
category.
all objective physical exam. And then it goes through the systems, but this is the recording of your physical exam, what you do when you put your hands on your patient. Now
Right.
you're describing
Now you
today.
could say red, irritated throat,
Right.
uvular deviation,
Yes.
whatever,
Yes.
I
Yes.
mean, you can say it all there.
You describe the objective exam. So again, review systems and physical exam gets confused with students still learning. Your review systems is your subjective
Objective.
your subjective report of your patient
Your
with the
objective.
symptoms. Yeah.
The
And then
review
physical
system is,
exam is
yeah,
objective.
is objective, right? Review system is subjective, physical exam is objective.
Yeah. So it's a little bit dicey when you're listening to this podcast, but I think if you're looking at the form and you're just listening to say, wow, I really need to understand the differences and what goes into what category, you're learning a lot today, which is what the goal is. After that, then you actually start typing out and thinking about your differential diagnosis, which is a whole nother podcast we'll talk about, because it's really an art to put together information and figure out what are the top differentials.
So what I usually tell my students is when you get to this part, go back up and highlight everything that makes you think this might be something important.
Right.
This is
That's a
my
great,
abnormals, and
yeah.
highlight those areas so that you can begin to see a picture. And once you can see a picture, then you can begin to start saying, well, what do I think it is? What's the top thing I think it is, the second top thing, and the third top thing, and what supports that? And that's a
What's
whole
the
nother podcast.
evidence that supports it? Right.
Right.
And then, depending on your faculty too, you may, based on the information that you have from your history, present illness, review of systems, history, and physical exam, your faculty may teach you to come up with the differentials first and then decide like what testing
Which
you would
one
do
is,
that's
if you
possible.
need any testing,
Right.
and then,
Right.
And
Because
then-
you don't want to
right.
you don't want to narrow your diagnosis yet, because if you just say, oh, for sure this is strep, you may miss something.
Right.
So the
it could
art
be,
of
it could be strep,
it could be strep,
mono, it could be leukemia, it could be lymphoma, it could be abscess, peritonsillar abscess, it could be nothing, it could be hand, foot, and mouth disease. I mean, there's a lot of things that it could be, and that's okay.
Yeah, you just don't want to. Another big thing you're going to learn from learning how to do advanced assessment techniques and documentation is there's an art of figuring out the differential, like Carol said, highlighting the objective information that would support the differentials,
and
then and what it's not, and then you figure out what your primary diagnosis is.
Yeah.
So it
do I need to run more tests to make sure? What do I think it is based on my evidence? And then you go from there. And that'll be we'll talk another time about our differential diagnoses, and we'll go through some cases where we can show you some of the common things and some of the zebras where it's not so common, and what our thought process was to come up with that differential or diagnosis.
So the main point is that this document may help you learn how to put all of your information together in a systematic way, and to teach you how your documentation will be as an advanced practice nurse practitioner, and start guiding you about differential and primary diagnosis. It also includes room for a plan, which is even beyond what you learn in advanced assessment, which is really,
so you can carry this form with you and kind of grow with it. Like I said, I can't praise you enough for coming up with this tool that helps students learn and organize their thoughts, where they're beginning to get that thinking process like a provider down, and getting to experiment with it. It's amazing what you were able to do, and I saw it firsthand as a teacher in your classes, that students really took off when they had that form. They were able to understand it better. They still have to get used to it, but it only takes one or two times versus they were on note 8 and still struggling.
Right.
Once you do get it, then you can apply it. Now, future recordings will be about differential diagnoses and how to kind of take that form and work your way down to that. What is the evidence that points to this? And that'll help you. And another thing I will do is take that form and show you how it applies to billing.
Right. We'll give you some examples, and so there's more to come with discussion. Hopefully just listening to this makes you understand that it's a process of really understanding where the different pieces go, how important it is to start learning how to do a history, what you need to gather, what you need to document, and how you start thinking about differentials. If you got that from this podcast, you learned a lot.
Yep. And that tool, please come to our website, NP's Changing Practice. Even if you can't download it right away, we will probably have a place where you can view it and see what we're talking about, at least, and know that we're getting it to the point where you can download some things, and that might help you.
Great. Thanks, Carol. This was a great session. Hope you enjoyed this, everybody.
All right. And please, like I said, visit our website and stay tuned. Tune in next week.
Thank you. Bye-bye.
Bye, guys.